I have been sharing with you over the last several medical minutes that vitamin D is more than a vitamin or a bone vitamin and is in the process of being considered a hormone because of all the vitamin D receptors in most of the cells in the body. However, the most vitamin D receptors are now being found to be in the brain cells. Therefore, studies are showing that the vitamin D is especially powerful against neurodegenerative diseases such as Alzheimer's dementia or other forms of dementia and Parkinson's disease. Long-term studies show that low vitamin D levels increase the risk of cognitive decline of any kind by 40 to 60%. It actually increases your risk of Alzheimer's dementia by nearly 80% and non-Alzheimer's dementia by 20-fold. Supplementation with vitamin D has now been shown to provide significant health benefits because the brain relies on vitamin D receptors for protection against a variety of destructive processes that can occur in the brain. Maintaining optimal levels of vitamin D has been shown to be necessary for nerve cell growth, nerve conduction, and the plasticity of the nerve connections that is so critical for normal learning and memory. Studies in patients with Alzheimer's dementia reveal that low levels of vitamin D actually increase the amount of inflammation in the brain, which can lead to the formation of an inflammatory protein which we call amyloid beta. Amyloid beta is the key pathological finding in patients with Alzheimer's dementia. Existing treatments for neurodegenerative disease can only treat symptoms and temporarily slow their progression. However, when vitamin D supplementation is added to these medications, studies are showing a reversal of this decline. A study reported in the September 2012 issue of Cognitive Behavior Neurology Journal demonstrated that when you add vitamin D supplementation to a common drug used for Alzheimer's dementia called memantine, for 6 months there are significant gains in cognition and mental function. My personal clinical experience in dealing with many patients suffering from chronic fatigue and fibromyalgia has been that they show significant worsening of their symptoms during the winter months and improvement during the summer. I label these individuals as having SAD, or what we refer to as seasonal affect disorder. However, over the past several years, I have actually been checking their vitamin D levels during this time and found that they were almost always very low. When I began supplementing vitamin D more aggressively, my patients began noticing significant improvement in their fatigue and mental alertness. In fact, I am now routinely checking my patients' vitamin D levels in the fall and being sure that these levels are in their optimal range. I have seen a consistent improvement in my patients and not seeing the normal decline or worsening of their symptoms during January, February, and March. I now believe that this more recent research and the fact that the brain relies so heavily on vitamin D to function at its optimal level is the reason I have been seeing this improvement in my patients who suffer from chronic fatigue and fibromyalgia. I now believe that this more recent research and the fact that the brain relies so heavily on vitamin D to function at its optimal level is the reason I've seen this improvement in my patients who suffer from chronic fatigue and fibromyalgia. This understanding of the fact that cells of the brain contain so many vitamin D receptors sheds an entirely new light on prevention of these neurodegenerative diseases that can be achieved by maintaining optimal levels of vitamin D. In my practice, I want my patients to maintain a vitamin D level of somewhere between 60 and 90 nanograms per ml. I find that the overwhelming majority of my patients are able to achieve these optimal levels of vitamin D by supplementing their diet with 2,000 to 4,000 international units of vitamin D3, the most potent and active form of vitamin D.